This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor. This program is for educational purposes only. The content is not intended to diagnose, treat, cure.
Hello and welcome everyone to Daily with Doc and Becca. My name is Ruth Ellen Sanchez and I'm going to be your hostess today. And today's show is sponsored by dailywithdoc.com and is for educational purposes only, and it's not meant to treat, diagnose, or cure any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA, nor have, testimonials are shared as individual experiences of the individual. Results may vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options. And that's one of the reasons why we're here, to help you explore your options. Also, if somebody referred you to this program, please make sure to get back with them because they are going to be your primary point of contact. And if you need to talk to a holistic health coach and you're not working with somebody else, please call us at 855-949-3377. And today we have the amazing Dr. Lisa Singletary, who is going to give us an amazing presentation on what color is your urine and what does that mean? So I'm going to go ahead and spotlight Dr. Singletary and bring her on the screen with me. And there we go. Welcome, Dr. Lisa. I'm so excited to have you here.
Thank you, Ruth Ellen. I was so excited when I saw your name on my screen. And I was like, oh, Ruth Ellen's calling. Yes. So you're doing such an amazing job, and I'm so thrilled to be here.
Thank you so much. We're so thrilled to have you here. And I enjoyed watching your podcast on your YouTube channel about the kidneys. So please give a plug to your podcast, to your YouTube channel.
Well, Dr. Lisa Singletary, or at Dr. Lisa Singletary, is my channel, and I will have a QR code at the end that you can scan to get right to my channel. But I do at least once a week health-related podcast, and I'm just having a ball.
That's good, and we can tell you're having fun with what you do.
And let me update my contact. Make it drlisasingletary.com.
Okay.
Because my last time here, there was a broken link or something. I think I tracked down all the links. So I think drlisasingletary.com is the best way to explore a little bit more about me.
Yes. And you're fun to explore and you're so knowledgeable. We love it. We love it. So I'm going to stop talking. I'm going to let you take over. Yeah, I can't wait to hear what you're going to say. So thank you so much.
Thank you. Well, related to my weekly webinars, which is called the Total Transformation Secrets Live Zoom, and the replay is on YouTube. So, but the last few episodes, I've gotten into some area that I really love. So, if I get the numbers right, I think webinar, I better not say the numbers. I'm going to say 67. I think is when I introduced Ernie the erythrocyte. And he's the first character of my superheroes of science. And we just took uh, just a great overview, I think, of what the erythrocyte does. An erythrocyte is a red blood cell, right? Erythro means red, and cyte means cell. And then the next, which was webinar 68, we took a dive into the kidneys. And not only, or not the whole kidney, but just one little area of the kidney that's called the glomerulus. And that was called the great body traffic jam, because the glomerulus is an area where your capillaries are at extreme risk for multiple things to happen. And once you understand what's going on inside that capillary, inside the glomerulus, it gives you an idea of how important it is to have your blood pressure under control and to have your blood sugar under control. And why is it that so many people that have a normal or an abnormal, blood sugar have an abnormal kidney, or if you have an abnormal blood pressure, you have chronic kidney disease. So, and then when they work together, it's a vortex of, of a bad situation. What do they call that? Vicious cycle. That's the V word I was looking for. So we want to break the vicious cycle. But we started with the beginning of the blood going into the kidney. Today, we're going to talk about what comes out of the kidney, which is the urine. And the stuff that goes on in between is amazing, but I can't go through all the stuff that's in between today. So we're just going to talk about the output today, and then stay tuned for future webinars where I will dig into what's called the renal tubules. And the tubules are the amazing structures that turn the filtrate that we found, in the glomerulus into the urine that actually comes out. It's amazing, but we're going to talk about urine today, particularly the color of the urine. So I used to love it when that share button was green, but here we go. We are going to share. Thank you for giving me the co-host power. I love it. And we're talking today, what color is your urine? And my source article today, I love me some healthline.com. And Healthline indeed has an article called Urine Colors Explained. And I put the link at the bottom. I hope you can see it. But it's healthline.com/health/urine-color-chart. And this article, I'm going to show you a couple more slides from this article. It's a really, really good article. I encourage you to screenshot the QR code if you can't, just grab the screenshot if you can't actually activate the QR code from what you're watching on. But one of the things I love about the article is it has this color chart, and it has 10, we only see 5 here, but 10 different colors of urine. So this QR code is for the chart. I mean, it's not for the chart, it's for the article, but I just put it up. I'm going to give it to you one more time too, because I really want you to get this article. And it also has a YouTube short. And I love the short. It's only, 24 seconds, something like that, but they talk about some of the colors. So I just loved this particular article. And it has another article or you might have seen, it has other articles that are related. So you can learn a lot about your urine just hanging out just from that one QR code. So, but this is a example of, or an illustration of my health journey through the years. And I just wanted to show you that because in order for me to go from the picture on the left to the picture in the middle, I'll just say this, it took one multivitamin, multi-mineral product. And that one product contained 87 out of the 90 essential nutrients. Some of you already know what it is. But in 8 months, I went from the picture on the left to the picture in the middle. Then I added the rest of the 90 and some keto, some learning about the good food, bad food list. And, I'm still on the health journey today, but this was my start to learning the power of nutrition. And from that experience, I developed the 5 M's of total transformation: mindset, macronutrients, micronutrients, motion, and measurement, because we got to keep track. So I am Dr. Lisa Singletary. I'm a retired board certified family physician. I have the privilege of being a certified holistic health coach. I specialize in total transformation, but a lot of that stems from weight issues. And I try to help people to be on a sustainable weight loss journey. And I love, as you saw, we were talking about a scientific article today. I love taking these scientific peer-reviewed articles and putting them into plain language so that everyone can understand and apply that information to their health journey. I do have a master's in public health. A lot of people don't know what MPH is, but I received that at the Johns Hopkins University. I got my MD at Howard University College of Medicine, my CWHC from the Institute of Holistic Health. And those are just the 3 that I kind of keep around. I have some others as well, but my thrill is sharing this knowledge with you. And just to let you know, there was a time in my life that I needed a miracle. Now, we don't talk about miracles in health and wellness, but this is also my reminder to give a little disclaimer. You already gave me a disclaimer for the show, Ruth Ellen, which is great. But I just want to say I am not a second opinion. I am not covered by your insurance. I'm not here to fight with your doctor so much. But hopefully this will be educational and maybe a little entertaining. And like I said, I'm just thrilled to be here. So we're going to cover today these 4 main areas. The hydration, like your baseline. What do we normally, what are the limits of our normal looking urine? What colors can we ignore? Those are the false alarms. What colors are red flags? And, what can we do to empower ourselves with this information? So where does the color come from in the urine? Well, it comes from a few places. Your stomach, your gut, the pigments in your food are chemicals that your body has to deal with. And the first place they go is to the liver, and the liver does a lot to process anything that you swallow, anything that you eat or drink. First stop is the liver. I should do a show about that. That's called the first pass effect. The liver gets the first pass, and then once the liver says, okay, these things are good, these things are bad, but these things we need to transform, and the results go into the bloodstream. Then after circulation for elimination, it'll eventually get to the kidneys. So the liver and bile ducts, depending on the conditions, they can give a brownish color to the urine. The kidneys, that's where everything happens. We're going to have an increasing understanding of what happens in the kidneys over the next weeks. But if there's damage in those delicate, vulnerable capillaries, then things can get filtered out of the blood that aren't supposed to be filtered out. Meaning there's damage in if you think of it as a sieve or a filter, if the sieve is damaged, then it doesn't function. It doesn't keep what's in the bloodstream stays in the bloodstream, right? Quote unquote. And then the bladder, once the kidneys are done with all the processing, that liquid goes down to the bladder to be eliminated. But if it sits in the bladder too long, or if there is any kind of bleeding in the bladder, or if there's infection in the bladder, then that can show in the urine as well. So here's the baseline. There's a natural yellowness to urine, and it might be diluted, it might be more concentrated, meaning you're dehydrated. I talk about people walking around like potato chips, right? We're dehydrated a lot, and sometimes we don't even realize it, and the urine is our main clue. So we want to be more on the pale side. So think of diluted lemonade as opposed to light beer or iced tea. That's one of our warning ones. But normally we want to be in the yellow area. Now, if we're talking about, and I'll mention this later, but many of us, when I say us, people that are on a supplement journey, many of us have more of an orange look to our urine because of the different supplements that we might be taking. All of that is within a normal range, but we can optimize it by increasing our hydration. So we could have, like I said, things that we eat that are pigmented. So those pigments actually, some of them have very important properties in our bodies. As far as antioxidants, the phytonutrients, you might have heard that word, but there's a reason the plants develop some of these phytonutrients, because they can't run away from predators. They can't run away when the wind blows, or they have to withstand their environment, and so they develop these antioxidants that help them to repair oxidative stress. And we can borrow those antioxidants by eating these super fruits and super juices. But those pigments can end up in our urine. Some medications give a different color to our urine. And this is what we want to make sure we know, that there are some colors in the urine that are red flags, and our body is really trying to tell us that something is wrong. So let's dig in. So the ranges of normal, clear urine, we don't want it to be absolutely clear, because that could mean you are overhydrated and you might be flushing out the electrolytes that you need. So it can be a problem if you're not drinking lots of water and your urine is clear, then there might be a problem, right? Because we want to have some color to the urine. Now, neon yellow, massive doses of B vitamins and some different nutrients can make your urine have a little glow. I love that glow, right? And when we're sharing the supplements with people, that's kind of a test. We can prepare them ahead of time to say, your urine's going to change color, or we can wait and say, you notice anything? And if they don't notice anything, they're probably not taking their supplements. So, but I like to prepare people. Now, if we're in the red or pink zone, again, it can be dietary, beets, right? Rhubarb, blueberries, medication side effects. But red or pink urine can be a medical red flag, meaning there could be blood cells in the urine. And if that's the case, then we really have to look at what's going on with the kidney function, especially at the glomerulus. So if you think you might have blood in your urine, then I'm going to share with you something you can do to kind of test that theory. And if the test shows that there's blood, then you want to track that down. But guess what? It's almost always going to be blood pressure, blood sugar, or a combination of the two. So it's really important. Just get to the basics of the good food, bad food list. Get to the basic of avoiding the bad foods so we can protect the glomeruli of the kidney, those high pressure capillaries. Orange alert, again, when you are dehydrated, then that's going to definitely change the color of your urine, and it can push into the amber looking or a deep orange looking, depending on what medications you take or what supplements you take. A red flag, however, if you have orange urine and light colored stool, so that combination, there can be something happening with your bile duct issues. So again, we're gonna try to sort the forest from the trees a little later, but one of the things you can do is make sure you increase your hydration and see, does hydration alone settle out that color or dilute out that color. Now, sometimes there are just some strange colors in your urine, such as blues, greens, even other colors. They can be related to some supplements, some foods, but usually it's something unusual, such as methylene blue or dyes from kidney tests, or some rare conditions can produce this bluish or greenish tinge to the urine. Tea-colored urine. We used to hear about this in medical school, but when you see it, it is, and I'll tell you one day. So I left medicine to take care of my parents. I was their primary caretaker for 8 years. And one day my dad showed me his urine and it looked like iced tea. And I said, Dad, we got to go. We got to get this checked. Because, and he did have kidney issues. He had high blood pressure. He had diabetes. So he was a textbook case for having his glomeruli at risk. And so we were able to get him under control. I marvel at him sometimes because he didn't develop diabetes until, or he wasn't diagnosed. I'm not sure exactly when he developed it, but he wasn't diagnosed with diabetes until he was 85. So we had to we had to get some education in him and teach him how to use his diet properly and hydrate and things like that. And he did amazing for 5 or so years before he actually passed. So there are things we can do to make the situation better in our kidneys, especially, I gotta say it again, with the pressure and with the sugar. But when you see this, when you see tea-colored urine, it can be, I'll say that, it can be a medical red flag. Now, there's some people, that little note at the bottom, this is rare, but there's some people that their muscles will start to break down and they have something called rhabdomyolysis, and that will make the urine this dark brown or this tea-colored urine, and that's something to watch, but usually that will pass relatively quickly, especially with rest and hydration. Okay, so it's not also, we don't just look at the color of the urine, but the texture of the urine. Is it thick? Is it cloudy? Is it foamy? Right? These can represent different conditions. I would say especially watch out for foamy urine in diabetics because, or high blood pressure, because that is an indication that protein is leaking out of the glomeruli, and that protein is causing the foaming of the urine. So that's an indication that something is wrong, whether it's from high pressure or whether it's from glucose, high sugar, damaging the capillaries. But those capillaries are extremely vulnerable. And we especially don't want to see this in pregnant women because there's something called preeclampsia that this could be a sign of. So we have to keep an eye out. So early warning signs. A lot of times our kidneys are trying to tell us something, and sometimes our kidneys will give us information before we actually feel it, right? So we might not have symptoms, but we want to watch out if we're making less urine, or if we're having to urinate too frequently, especially at night. Brain fog, insomnia, fatigue, any swelling, in your ankles, but when it swells in your eye areas especially, we want to find out what's going on. And muscle cramping, like it could be an electrolyte imbalance, but it could be something a little more dramatic happening in your kidneys. When we get further past those early warning signs, then again, we want to look for darker urine, foamy urine, maybe blood in the urine, and all of these things. Again, this is not to scare you. This is to make you aware that your kidneys, your urine can be telling you a lot, not just how much hydration you have, but there are other things that your urine can be showing you. And so here's a little chart. So I'm going to give you just a little time. You can screenshot this. And I think maybe on Saturday, I will put this chart, because I'll talk about this on Saturday. I'll put this chart as a download. But just to give you an idea of the different things that can go on if you see these different colors in your urine, and what can we do about it? Well, here's a little flow chart. So if you notice a weird color, you want to ask yourself, did you eat beets? You know, if you saw a red color in your urine, did you eat a highly pigmented food, or start a new medication or a new supplement? If the answer is yes, then wait 48 hours, hydrate, and if it's from the food, then you know, it should go away within a couple of days. If it's from a supplement that you're taking, a new supplement or new medication, then it's not necessarily going to go away, but the hydration should help. If you have high pigment in your urine and you have not started a new medication or eaten a highly pigmented food, drink a large glass of water, get some rest, and wait a little bit. And if after a couple days it's still a weird color, call the doctor, right? So we give it some time. But the other thing you can do is, let me see that note down there. Skip the wait and call immediately if the urine is cloudy or foamy during pregnancy, or if you suspect blood. All right, this is what we're going to do. Oh, it's not on this slide. I mean, it's not in this slide deck. All right. So what we're going to do in this algorithm, we're going to be able to add a measurement. You know, measurement is one of the 5 M's. And the measurement we're going to add is we can get urine test strips. You can go right to the drugstore or, you know, grocery store, pharmacy. They're all over the place. You don't need prescriptions for most of them. You just get a urine, and you have to watch the strips. There are some strips only have 1 or 2 things that you can test. Actually, I think I have a picture of some urine test strips. So once I stop the slides, I'll see if I can pull that picture up. But what you want to do is get the strip that's called a multi-stick. So dextrose sticks will only test sugar, which is important. But the multi-sticks will test for blood, they'll test for your pH, they'll test for your sugar, they'll test for multiple things that can be in your urine, and it gives you a color spectrum to see, okay, this is really high, or it's a little colorful, but it's not, it's kind of on that low side, closer to normal. So, so we don't just have to go by our memory of what we ate or a hunch. We also have a way that we can test. And I love that, right? So, all right. So I also want to share the 5 steps to nutritional completeness, because it's being able to give your body all of the 90 essential nutrients where your body is going to thank you. And on a cellular level, it's going to be able to function to the max of its ability. So step 1, we want to avoid foods that cause inflammation and oxidative stress. Now, we've talked about a lot of foods today that have a lot of color. We like those foods, right? They're going to be on the good food list. So we want to be aware when we are eating foods that are highly colorful and see what our urine shows after we eat them. Or if we see our urine abnormal, think back, okay, what did I eat? But the good food, bad food list is our number 1 tool for step 1 for avoiding the bad foods. Step number 2, we want to get the 90 essential nutrients. Step number 3, and I'm going to share those next slide. Antioxidants, adaptogens, anti-inflammatories. So our bodies are designed to handle a certain amount of oxidative stress. Our bodies create a certain amount of oxidative stress, but when you add the modern diet, the modern exposure to radiation, chemicals, nanoplastics, all of these things cause oxidative stress in our bodies. And it's causing more stress than our bodies are designed to handle. And so we can give them help by giving antioxidants, adaptogens, anti-inflammatories. Step 4, digestive health. Our gut lining has to be normal to function, and has to not be inflamed in order to function normally. So an inflamed gut does not function normally, and that means even if you're taking in the good nutrition, your body can't absorb it. So we want to be very mindful of the health of our gut lining and of our gut microbiome. Our gut microbiome is so important because it's not just a bunch of bacteria in your poop. They're active producing substances that affect our whole bodies, including our brain. So it's all connected, right? Step 5, wellness wonderland. This is where we have targeted supplementation, brain support, joint support, kidney and bladder support, lymph support, you name it, right? And massage therapy, Reiki, infrared lights, all of these things that are available to us in our wellness journey, they're on step 5, but that rests on the foundation of the first 4 steps. And just to look at the 90 essential nutrients, I try to emphasize the word essential because it has a specific meaning, really a double meaning. So when something is essential, what do you think? It means you need it, right? But medically, biochemically, the word essential means your body can't make it. So in order to get these 90 essential nutrients, you have to take them in. And we can't rely on our food anymore. So, thankfully, we have amazing plant-based supplements, or natural supplements, cellular nourishing supplements that we can bring to the table. Okay, so my webinars, I've been saying it, I would love for you to join me live on Saturdays at 11 a.m. Eastern. And so you can scan this QR code to register for Total Transformation Secrets. And you'll get all the information for how to join live. And every Saturday, once we do the live show on Saturday morning, I put the replay up Saturday evening at 9 p.m. Eastern on YouTube. And it just stays there after that. But the first show on Saturdays at 9 p.m., I am actually in the chat. And, we have a lot of nice interaction. I'm just noticing I need to change the slide. Okay, I'll put that on my to-do list. But we have a lot of nice interaction in the chat, in the premiere, the first showing on YouTube. So this QR code goes right to my channel. All right, so those are the secrets. But I do want to say, let's see, we're going to exit. Let me see. Yes. Let me know if you can see this. I just Googled urine test strips. I think you can still see this. So there are all kinds of strips, right? So you want to buy the strips that are what we call multi. So they're keto strips. They only have 1 or 2 testers on the pad. Well, the ketos only have 1, but keto diastics might have 2, but the multis have many. And that will be including blood, like I said, pH, different measurements that will help us determine if our urine is looking a different color, should we be concerned? All righty. So I see a hand. I can take some questions, right? What time? Oh, 3:42. Okay.
Yes, Mary, go ahead. Thank you so much, Dr. Lisa. Mary, go ahead.
Okay. Hi, Dr. Lisa. That was very, very informative. I learned actually quite a bit in the presentation. A couple of questions. One is, I did have a client that started taking the BTT. They took it in the tablet form. And I didn't think they would get the different color urine. Mostly I thought it would come more in the powder, which we turn into liquid, which would be easier to get a different urine color. But she did. She got a darker yellow, I would say, to maybe a light orange.
Sure.
Which kind of fits in line with, yes, we're taking a new product, and that will likely stay. But she went to her doctor. She wanted to ask about the urine color and the change, and is that normal? What should I think about it? And I told her, yes, it is normal. But her doctor said, well, she took a look at the bottle, of what she was taking. She's like, well, you don't need all those B vitamins, so I recommend you cut back. And of course, she was taking tablets, so she could cut back to the number. And I said, okay. Of course, the doctor's prescribing her lots of things to manage metabolic syndrome, but from a prescription standpoint. So what would you say about that interaction, and does she really need to cut back on the B vitamins? Obviously, Dr. Wallach put these formulas together for a reason, but that was what her medical doctor told her.
Yeah. So one, the formulation is based on decades of research, right, from Dr. Wallach, including or primarily autopsy research, which means he's looking at the tissues and he's looking at the cells of all of these animals and people that supposedly died of natural causes, right? And found out that those are not natural. So the basis of the formulation is hard science. And he has the Dr. Glidden calls it reductionist. He does not have the reductionist philosophy where you just look at one thing. It takes a village. It takes a village of supplements. It takes a village of organs to have everything running together. So, but if I could show, I have a little chart that might help to talk about the powder versus the tablets. And I don't know why they gave them the same name, but in one serving of powder, our organic whole food blend, 5,700 milligrams. 4 tablets, 800 milligrams. Amino acids, 575 versus 100. So the tablets have nowhere near the nutrition that the powder does. Right. So I could see why maybe some people don't have exactly the amount of color in their urine that they do get with the powder, but it's there, right? They do have these complexes that give color to the urine. So, but what the doctor said, I believe, is uninformed.
Yeah. Right.
And we're taught, when I say medical allopathic physicians, we are taught that you're just peeing out expensive urine. We are not taught that it's an insurance policy for your body. I don't know if I could say that. But your body, and I love this, I'll say for me, when I'm under stress, my urine is not as dark. Because in my interpretation of that is my body is using more of the BTT.
Sure.
But when under normal circumstances, I do have a normal color, that I associate with the BTT. Now, not so much color for me with the 3.0. I really, and I missed it, when I switched to 3.0, I was like, oh. So sometimes I'll get the 3.0, but I'll add some BTT just to, but also always I recommend adding extra minerals.
Yes.
Especially with the 3.0.
Yeah.
That's another chart. I got another chart, but I won't show any more charts.
Right. Well, fortunately, she did do that. So at least we got those in addition to the BTT, although some people just, at least they're getting some in, not the same quantity as the powders, but they want the tablet form, and at least they're trying to start the process of nutrifying their body.
Yeah, I try. I do sometimes use the on-the-go packs as the entry product sometimes, and people love just to get them in the habit, right, of the nutrition. But I do try to emphasize you're not getting the full dose. I mean, I told somebody, now we've got enough nutrition in you for your left leg, right, from the on-the-go packs. We need nutrition for your whole body. So, and then the powder is the upgrade from the tablets.
I love that comment. I love the comment. Excuse me. The second question I had is, you mentioned the urine strips, which I didn't realize they had so many multi test strips. I know of the kind of 2 colors versus the 6 or so that you showed on that. My question is on the pH of the urine. Is there a, I guess, target or recommended pH? I know that's probably a whole
I
different
love that
discussion.
question. That is such a good question, because when I say people, a lot of companies market tests of pH
Mm-hmm.
of the urine, and they'll tell you if you're acidic or if you're alkaline.
Mm-hmm.
No, they can't tell that. You cannot tell that from the urine. I hope I can. Okay, so when we say that the body is a little alkaline, that's the blood.
Mm-hmm.
And the urine, the kidneys are what help to keep the blood alkaline.
Mm-hmm.
So if there's some extra stress going on, or if there's anything, the blood starts to get a little close to normal, a little less alkaline than we want it, the urine is going to flush out that extra acid.
Mm.
So the fact that the urine is acidic does not say what the blood is.
Mm-hmm.
So if there's acid in the urine, that's your body keeping your blood in a normal pH.
Okay. And would you say that in your interpretation, more acidic is worse than kind of, let's call it, let's say the 5, which is fairly acidic for urine, to maybe 6 or 6.5?
Yeah, you don't want to have that kind of stress, right?
Okay.
But and I'll talk about your kidneys are amazing
Mm-hmm.
as far as I call it the adjustment bureau. The tubules of the kidneys. You know that movie has nothing to do with the movie. I just like the title.
Right.
But your kidneys can adjust to multiple environments and it can adapt. But the whole function is to keep your body in homeostasis, in dynamic equilibrium. And it is a beautiful thing. So a highly acidic urine, that might mean that there's a lot of stress going on and we want to have a better environment in the body. But that does not mean that your blood is acidic.
Right. Because it
If
keeps
your
in a certain
blood gets
range.
acidic, then you're talking metabolic acidosis. That's bad, right? And if it's too alkaline, which you can have metabolic alkalosis, bad. We want to have our pH. It's one of the Goldilocks measurements. It has to be just right. And our kidneys help our blood pH to stay just right.
Got it. Thank you. I'll turn it over to Ruth Ellen to manage the questions.
Thank you very much, Mary. And we have Yesenia with her hand up. So Yesenia, if you can unmute yourself, and then I have a question from Facebook or YouTube. I'm sorry.
Thank you. I have a quick question. So when you're going through menopause or postmenopause, will your urine be different?
I'm just writing it down. I don't have let me think. I would have to think about that, but anytime your metabolism is different, then your urine is going to help to compensate. So I could see episodes when that is the case. But if you would allow me, I can do a little research and see if I can find research articles that actually correlate the two.
Yeah, that will be fine. And then do I have time, Ruth Ellen, to just give a quick testimony real quick?
Yes.
Okay. I went to get my hair cut just a couple of days ago, and just a trim. And I was very surprised that, it really surprised me that my hairdresser said, you have a lot of growing hair, like a lot in the top area. She said the bottom is thin, but you have so much growing hair. And I thought the only thing that I'm doing is taking the 90 essential nutrients. That's it. So I went home and I thought, I'm already in menopause. So I thought, you know what? That is the number one thing that we had, that I remembered looking at. That I wish every time I would bathe, I would shed, I would wash my hair, I would shed some hair. But when my hairdresser said that, it made me really happy. So I just wanted to share that. Thank you.
Thank you. That's fantastic news. Yay.
It's
I'm
wonderful.
so excited for you. That's wonderful. Wonderful. I love stories like that. I do. The slightest, just your hair growing in that's huge, actually. It's really huge. It's not a little thing, it's big. So be great, I'm just happy and grateful for you. All righty. So we have an interesting question from YouTube from Olga. And she says, when colorful urine leaves the body through the urinary tract, do those nutrients feed the tissues they are passing through?
At that point, they have already done the feeding.
Okay.
And what happens in the kidney tubules, if nutrients are in the blood that are filtered out, there's an area in the kidney tubules that reabsorbs the good stuff.
Nice.
It's amazing. And so it's like, oh, nope, you're trying to escape. No, you can't escape. We're going to reabsorb you back into the body. And then maybe a couple of passes later, after the good stuff has done this job, then it's going to allow it to leave the body. So once it's left, it's already done its work.
That is fascinating. The kidneys are amazing. Oh my gosh.
Yeah.
Wow, that's really amazing. My mind has been blown.
Yeah, that's at the distal convoluted tubules. If you want to look it up, the DCT is where it reabsorbs the good stuff that's filtered through, and the body's like, oh no, we need that. Let's bring that back. We'll let the water go. We'll let the waste go. We'll let the pH, the extra acid ions go, but we need that.
That's amazing. Absolutely amazing. Who would have thought? Okay, let me see if there's any other questions anywhere. Hello, Harry, Flying Angel. He's sending blessings, Dr. Lisa.
Thank you.
And he says, great information. And then MRROW, or DW, I should say, hello, Rumble Nation. This topic by Dr. Singletary is so timely and needed.
Thank you. Amen. Amen.
It is, because we kind of ignore kidneys to a certain point.
Yeah.
We always focus on like the liver and the gallbladder and the different things. And sometimes, your podcast from last Saturday, I never knew 90% of what, I shouldn't say that. I didn't know like 60% of what you talked about with the kidneys, because Dr. Wallach always talks about you have these little tiny capillaries and they're like microscopic and they get clogged, and you showed them and I was like, what?
Yeah.
Oh,
there's a whole nother capillary system in the kidneys. That's the low pressure from, around the tubules. But those glomeruli, they are under attack. They're under siege by high blood pressure and by high blood sugar. So
that's amazing.
And so someone shared at some point, or Dr. Wallach has shared, how sometimes urine or people with kidney failure, their kidneys are taken out and they're normal. But it's not, it's because the kidney tissue is normal, but the glomeruli are damaged, which means the fluid, everything downstream, there's a problem. But the actual kidney function would be normal if we could take care of those little glomeruli.
Wow, that's amazing. Yeah, my mind's, but okay, we have another question from Becca Dukes. Hey there, Becca.
Becca.
Yes. She would like to know Dr. Lisa's thoughts about the practice of drinking one's own urine. Practice of drinking one's own urine is most commonly known as urophagia. In the context of alternative medicine, it is frequently referred to as urine therapy or urotherapy.
Yeah, I can't get with that. And I promise you, I have not looked it up. I've heard about it, but that's just knowing that the function of the kidneys is part of your excretory system, and it's to excrete or get rid of from the body the waste products. Hey, show me an article, I'll read the article. I still won't drink my urine. Now, there are, we had many stories about people doing surgery under extreme conditions like no running water, and they would, get a little kid to come and urinate, and that would be how they wash the instruments or things like that. But assuming that their urine was sterile, that was a little stretch for me, but I understood it, especially after multiple trips to Africa. So it's like, okay, I can see. But yeah,
I know.
it
If I
just
was,
doesn't make it, and like I said, I've had an allopathically trained brain. I admit it. So I'm on the journey to understanding and the natural and alternative therapies. Now, one thing that was very instrumental in my opening my mind, I guess, to alternative medicine was I actually bought a book, a textbook called Alternative Medicine, and it was like this thick, big book. And there was this one sentence in the book that was, I was reading a chapter on energy medicine because I was trying to understand, I was trying to wrap my mind around Reiki and, different energy healing. And there was this one line in the book that says, all medicine is energy medicine. And I was like, you're right, because I used to teach physics, so I understand there's chemical energy, there's physical energy, there's sound energy. So if you're given a medication, that is chemical energy happening in the body. So that like unlocked the door of my mind to learn about alternative medicine. But it's going to take a whole nother door to unlock what was it? Urine therapy. So
oh my goodness.
I just haven't studied it. So.
Yes, Rebecca says, LOL, I'm with you, Dr. Lisa. Yeah, I'm going to have a hard time. I mean, I've heard of people who've been like stranded in the desert and drank their urine just to keep themselves hydrated. And I can totally understand that.
Yeah.
And, maybe I would do that if I was in that between life or death, but I just can't. I'm with you. And I know that there's a whole group of people that believe in drinking their urine and bathing in their urine. And
yeah, I've heard of it. But I haven't studied it. So
now we have one more hand up. Did you have a hard stop? I forgot to ask you.
I'm good.
Okay. All right, Marilyn. Oops, I'm sorry. You're muted. I accidentally hit unmute when you muted.
Oh,
and whatever.
okay, I just want to say that I have had ozone therapy and I have had urine therapy, but not where you drink it, but they inject it to you. And I did it for like 3 months and I felt incredibly well. Incredibly increased energy through the ozone and the urine therapy. Now, what I was told was that your body produces specific antigens that are specific to your body. And when you reintroduce it back in, your body produces antibodies to those specific antigens. And it was down in Mexico. It was a doctor. He was an American doctor, but he was practicing down there. And anyway, I did it, and you have to have a special filter that filters out, like E. coli and salmonella, some of the bad bacteria. But the antigens are so small that they seep through and they get through the filter, but the filter traps, the bad bacteria that cannot be reintroduced back into the body. Anyway, that's
okay. I get it.
Okay.
Thank you, Marilyn.
I'm scared, but I get it.
I'm fine. I'm here. I did 3 months. Like every day they did it.
So this is the body's amazing, right? And this is one of the things I didn't explain quite so well when I was talking about earning the erythrocyte. But if you consider the venous blood, your waste blood, the oxygenated blood is the fully stoked up, souped up blood. By the time your blood goes through, by the time your red blood cells go through the capillaries, deposit the oxygen that the tissues need, and start circulating back to the heart to go to the lungs, it's only 75%. It still has 75% of the oxygen carrying capacity. So, quote unquote, the waste blood is still jam-packed with, great things, including oxygen. So the body's amazing. So hats off to the people that, are learning more and more of the ways that we can nourish and support the body.
Thank you, Marilyn. I just I'm sorry. I just don't know if I could do that. But I know a lot of people that do, and I have some clients that do that type of therapy. So thank you so much, Dr. Lisa. It's been wonderful. I can't wait for your next talk. Are you going to go deeper into the kidneys, maybe?
Oh, yeah. There's a lot to talk about in these kidneys, these tubules, and secretion and all the things. Yep.
Very good.
Countercurrent multiplication. Don't get me started. Okay.
Oh my gosh, I don't even know what that is.
It's how your kidneys make your urine, can make it either dark yellow, concentrated, or light yellow, depending on your hydration status. It's like, how does that happen? Countercurrent multiplication.
I can't wait. That sounds fascinating. It does.
It is.
Well, thank you so much for everything and being on the show with us. And can't wait till your next visit. I'm excited. And then you did share the link to your podcast on YouTube. And can you give us
Dr. Lisa Singletary is the
at
YouTube channel at Dr. Lisa Singletary.
Perfect. All right, very good. And if I could get my co-host to come back on the screen with me, then we can wrap up the show. And I want to thank everybody for joining us today. It's always amazing information. I'm so grateful to be part of this team and doing this work. It's very rewarding. So if you would like to join our team and have any questions about that, please give us a call at 855-949-3377, or you can email us at questions@dailywithdoc.com. And again, this program was for educational purposes only. And tomorrow, Rebecca Dukes is going to be your host because she is back home and back in Pennsylvania. Yeehaw! Welcome home, Rebecca. I've missed you terribly. And she's going to have a special guest tomorrow. I believe it is Carrie Scott is going to be joining her with a fascinating story about her child's return to wellness. And it's going to be really good. Also, I think I think I did that. I did that. Okay, so please be kind to people and know that everybody is going through something different. So just be kind and make sure you say hi too, because sometimes that can save a life as well. You hear stories. So our fabulous team that is with us today is Sherry, who is part of the tech crew, and she helped set up everything going out into YouTube and everywhere. I send the signal to Sherry and she sends it out. So thank you for that, Sherry. And then we have Mary, who has helped us yesterday doing speedy fingers to the best of her abilities. And today she was out there on the different platforms bringing in questions. And Sue Dell on Facebook, I did post the link to the multi-strip blood in urine like you asked. So I didn't want you to think I didn't do that in the different chats here. So thank you for that. And Mary, you're awesome. Also, Marilyn, glad that you are feeling better today and that you're here doing your magic with the keyboard. So thank you, thank you, thank you. And we have Albert, who is here with us from South Africa. And he is the person that's going to answer the phone number in the middle of the night. And so if you get somebody with this fantastic accent, that is him. He is our gatekeeper and a true gentleman, true sense of the word, gentleman. Love him. And then we have Rod, who is not on camera, but has been out there posting and bringing questions in and letting me know that there was a question that I missed. So thank you for that. Also, AJ, who's not on the screen today, he is our digital marketing director and a manager, sorry. And thank you so much for all that you do. And another huge welcome and thank you, Dr. Lisa. I'm so grateful that you were here today. And I look forward to having a conversation with you maybe later today. So everybody, enjoy your weekend. Or no, sorry, I'm the one leaving. You guys are. Well, enjoy seeing you tomorrow. So enjoy your evening. And then looking forward to Rebecca being back on screen. See you later. Bye, everybody.
This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in Pathology, Naturopathic Doctor.